Yes, good afternoon, and thank you for inviting me here to discuss this concept of the healthcare ecosystem. The concept was developed as a consequence of the current healthcare environment that we find ourselves operating in. Departments, healthcare systems increasingly find themselves confronted by decreased reimbursement in a recession, patients who are less frequently using the healthcare systems for elective medical treatments, more often delaying their treatments. There are a lot of challenges that our healthcare systems are facing at this point, beyond the contentious battle regarding healthcare reform in the Affordable Care Act and Patient Protection Act insurance mandates. It's an incredibly difficult time. So one of the challenges that we have identified is the issue of addressing health disparities and healthcare disparities that disproportionately worse medical state that many individuals find themselves in, individuals across various race, ethnicities, cultures, gender, and geographies find themselves disproportionately burdened by chronic medical conditions like diabetes, hypertension, cardiovascular disease with worse health outcomes. And for a long time, this has been an issue that has needed to be addressed. However, it's remained on the back burner. And now that we find ourselves in a very challenging economic time, people consider this an issue that continues to take a low priority. However, our premise is that healthcare disparities represents an opportunity, sort of a low-hanging fruit, if you will, opportunity to address this issue in a way that has a business case and can significantly reduce healthcare costs for across the healthcare system and across the healthcare environment. The challenge is that healthcare systems have not known how to systematically address the issue of health disparity, cultural competence within the organization to the extent that it could be done efficiently in a financially responsible way and yield an effective improvement in clinical outcomes that justifies the existence of programs. And so our healthcare ecosystem paper lays out the premise of how this should be done in a systematic way to achieve these endpoints, because clearly we want to provide better care to all populations, specifically those populations within the community that are disproportionately affected by chronic conditions and health disparities. And we want to do this in a cost-effective way that provides the best clinical outcome per dollar spent over the disease care cycle. And this is something that to this point in time we've not done effectively. We can do it effectively, and it can benefit all of those within our community. And I guess the most compelling point is that we have to make the argument in the case to the population at large that if healthcare disparity continues with the associated increase in cost, at the end of the day, it is the population that is insured and not affected that is burdened with the costs of those that are uninsured and are affected by health disparities. That case has to be made in a very compelling way